Hey guys, this is Tiffany Martin, and this is Medical Microbiology, and we are working our way through Chapter 9. This is our second in the series of Chapter 9. We are getting to the section of the PowerPoint where we are talking about how do we select these antimicrobial methods. Chapter 9 is controlling microbial growth in the environment. We talked about some terminology and some vocabulary in the last video, so make sure you know that. And so now we're at the point where, so how do we do it? How do we determine what types of things we're going to use to inhibit microbial growth in our environment? There's a lot of different ways we could do that. So you already know how to do this. You are making those decisions already in your houses. I'm just going to give you some terminology for this and a little bit more understanding about what we talk about in the medical field. But again, you make these decisions all the time. You have to determine in your house what type of antimicrobial control technique you're going to use. Are you going to clean your toilet? Are you going to clean your bedroom dresser? Do you do that the same way? Of course you don't. Are you going to do you clean differently now that COVID-19 is present in our environment? Are you wiping things down? Are you being more careful? If someone is sick in your house, are you cleaning differently? If you're trying to clean something on your skin, you use different chemicals than you do if you're trying to clean your kitchen table. If I am trying to clean my kitchen floor versus my kitchen counter, I'm going to make some different decisions. So you are making these choices every day. We're just going to kind of lay it out and help you determine what you're really thinking about when you're making these choices and then how that applies into healthcare settings. Okay, so let's go through some of the PowerPoints. Selection of microbial control methods. The first thing we're doing is we have to consider all of the factors that determine how effective this method of controlling microbial growth is. First thing we have to determine is what surface am I trying to disinfect? Is it my toilet bowl or is it my wooden dresser? Is it living tissue, fragile objects? You're going to make some decisions based on what you're trying to, what surface you're trying to control microbial growth. So that's for sure. You're also going to make some decisions based on potential risk of infection. The hospital surgical unit is going to be disinfected very well. The hospital waiting room is disinfected, but the surgical room is sterilized. Things have to be sterile in there. Potential risk of infection. How likely are you to come in contact with something that's bad? Hospitals, a higher risk. In our homes, not as much. So what's your potential risk of infection? So you're going to consider that when you're making these choices. You also need to determine what are you trying to get rid of? The relative susceptibility of the microorganisms that you're trying to get rid of. And some things are harder to get rid of than others. We've talked about endospores. Endospores are those thick layers that we've just talked about. These are very hard to get rid of. They can resist most conditions. They can resist your bleach and your Lysol. How do you get rid of these endospores forming bacteria? Enveloped viruses, that's our COVID-19, that's our influenza, our cold viruses. These are actually very easy to get rid of. Again, if we can take away that membrane, and membranes are easy to get rid of, on the outer surface, that's going to have those glycoprotein spikes. And if it does not have those that membrane containing those spikes, then it can't invade us. It can't get in and attach and stay. All right, so what are you trying to get rid of? If you're trying to get rid of enveloped viruses, a little bit of spray, alcohol, lots of things will get rid of that. If you're trying to get rid of endospores, you're going to have to take it all the way to something that will sterilize. You have to pick a method that you know will sterilize. And again, the definition of sterilization is to get rid of these endospores. Now, mycobacteria are just below that. These are some bacteria that have an outer membrane that has a lot of these extra waxy lipids. They're hard to get rid of. Tuberculosis is in this category. It makes it very difficult to get rid of. Protozoan cysts are right underneath that. Protozoans, Giardia is a common protozoan that lives in North American rivers, streams, and such. If you do not properly treat your drinking water when you're out hiking, you may be able to kill the protozoans just by boiling, but these protozoan cysts are more resistant, and you've got to get rid of those. Otherwise, you drink the water, the cysts are in the water, gets into your gut, the cysts then develop into protozoans, and you'll get a diarrheal-based disease from that. All right, and then you've got kind of an area, we're getting easier and easier to get rid of. The protozoans themselves are easier, and then gram-negative bacteria, fungus, non-enveloped viruses, which is the protein. Gram-positive bacteria, actually pretty easy to get rid of, and enveloped viruses are the easiest things. What should you know from this? And we know prions. We talked about prions and what they are in our virus chapter. And prions, you cannot get rid of them by sterilization. The only way you get rid of prions is complete incineration. There is an enzyme that you can get rid of, but they're very hard to get rid of. So what do you need to know? I would know these top 4 for sure. And then, kind of knowing that there is a continuum of things to get rid of. Envelope viruses are the easiest, but definitely know the top 4. You definitely want to know where endospores fall. Now, typically the methods we're going to talk about, if they're severe enough to get rid of endospores, they'll get rid of anything below that. There's a few exceptions for those. I'll point those out. But if a method will get rid of endospores, it'll typically get rid of anything else. If it only gets rid of gram-negative bacteria, it'll typically get rid of anything below that, but not anything above that. So keep in mind as we're working through. So that is something you need to consider. What are you trying to get rid of? Do you have a patient that has tuberculosis and has this mycobacteria? You're going to have to do some different disinfection methods than if you have a patient that had an enveloped virus. Okay. All right, so what else do we need to consider when we're making these decisions? We also need to consider how clean do we need it? Levels of disinfectant potency. Do I need to be at the highest level? Do I need to have everything gone? Or is a low level good enough? What's the difference from that? Highest level, this will get rid of endospores. This will sterilize. If you are going into surgery and you're going to cut open a patient, you are opening up their body, taking away all of their protections, their skin, mucous membranes, all of those things that protect us. You need the highest level of disinfection. That would be surgery, critical items that are going to come in contact with a patient in places where normally bacteria should not be. Intermediate level. This is where you want to get if you are still leaving some of the patient's defenses intact. So say you've got like an endoscope. You want to go in through the mouth and the nose, and you want to look into that. So surgery, you're going to have people gowned up, completely sterile environment, no contamination at all. That's the highest level. If you're doing an intermediate level, so you may be going in with some scope into that, intubation from that, you want to be at an intermediate level. Doesn't need to be sterile because the patient still has mucous membranes that are protecting them from that. Now, the COVID-19 and the intubation, what they're talking about is that these viruses are then aerosolized and can be easily, gotten into, inhaled by medical professionals. So that's why they're talking about the coverings and everything during intubation. But typically, it's not done in a surgical environment. It would be done in a disinfected environment with some personal protection equipment for sure, but the mucous membranes is still protecting the patient from that. All right, so that is an intermediate level. If we're talking about a low level, this will get rid of some things. If a stethoscope, your patient is still being protected by their skin, this is a low level of disinfection. Wipe it off with, a bleach or an alcohol wipe or something. But if some things remain, it's okay because the patient's own immune system is going to be able to fight it off. All right, so what type of disinfection do you need for that? These are things that you need to consider when making these choices of controlling microbial growth in your environment. What else do you need to do? You need to take into consideration the environment that you're working in. Temperatures that are warmer typically increase the effectiveness of these agents. These agents that we're going to use, these chemicals, these methods are going to disrupt proteins. They're going to disrupt cell walls or cell membranes. When we're talking about in general and metabolism and chemical molecules, the higher the temperature, the faster those molecules are moving. So they will actually work better. So you can see these disinfections at a higher temperature because everything's moving faster, the chemicals moving faster, the cells the microorganisms are moving faster, they tend to work faster. So temperature does play a role in this. It's harder to kill things in cold storage. Metabolism has slowed down, chemicals have slowed down. It's going to take a longer time for chemicals to work. So that's something you need to take into account. pH can also make a difference. If you're working in a pH that's not neutral, that can make a difference. And then the biggest thing for us is that many of these disinfection techniques do not clean. They do not work through contaminated matter. They do not work through organic material. So you've heard the term clean and disinfect. This is because cleaning and disinfecting is two different things. If you clean something and disinfect, cleaning is you're removing all the organic matter. Maybe it's a diaper changing area and the baby is being changed in a diaper changing area, and you might get some fecal matter that contaminates the pad. And so you remove the baby and you need to disinfect it. If I spray some stuff on it and kind of give it a quick wipe or even just let it sit for a while, that fecal matter, even if I can't see it, that fecal organic matter is sitting there, and underneath it, the disinfectant that I sprayed on top is not going to work through that, and I'm going to have living microorganisms that are not going to get disinfected from that. So then we talk about cleaning and then disinfection, some friction, some cleaning to get rid of the organic material, and then disinfecting. So that's something to do. Vomit, pus, all of those things can inhibit the effectiveness. If it's not coming in contact with the microorganisms directly, it's not going to work as it should. So cleaning and disinfection. So you need to remember that as you're doing this as well. Dirt, tissues, blood, kind of stuff. Okay, what else do we need to know? All right, anything we're doing, you've seen a lot of things thrown out in the media about use Listerine, use alcohol, use hydrogen peroxide. What can we use? You can't find any Clorox wipes. What can I use instead? We have to know if our techniques are working. Are we really disinfecting? Are we really getting rid of 99.9% that the bottle is claiming? So in order to do that, we have to compare and evaluate these disinfectants. Here in this country, we have methods to determine if a company can say it gets rid of 99.9%. Things that are regulated by the Food and Drug Administration or the Environmental Protection Agency have to go through some stringent requirements before they can say, yes, this will get rid of viruses, bacteria, fungus, that kind of stuff. This is so we've been evaluating disinfections. This is kind of a historical thing, I like my history. And you remember back to Lister. This was chapter 1. Lister was the surgeon. I remember Lister was the surgeon that was the first person to take phenols. He was using carbolic acid, which is a phenol, and he was wiping off the surgical tables. He was wiping off the instruments that they used for that. He was actually soaking the dressings that they used in a disinfectant and wrapping the patients from wounds in that. He was the first person to kind of introduce those aseptic techniques, and his surgical outcomes were much better. The patients weren't dying after surgery from infection later on, from gangrene and from those things. So he was the first person to do that. So when he started putting those out there and sharing that information, then people started looking at other chemicals. If we remember back to Semmelweis, he was the one that had the med students dip their hands in chlorinated lime water. He was looking at chlorine versus phenol. So they started saying, well, which one's better? So they started comparing. So since Lister was the first one, they started comparing everything to Lister and what he did. And so there became a comparison known as the phenol coefficient, and they called it a PC. And they looked at everything and compared that back to what Lister was doing. Okay, so we, again, as soon as we figured out how this worked, we started evaluating it. We don't do this anymore. We've got some better methods. What we use in this country is the use dilution test. And so everything that is produced and sold in this country has to be evaluated in this method. And this is what we did in lab. If you go back to your lab where we had the beads and we soaked it in the bacteria and then we put it in the different dilutions to see if it would kill it and had it a certain amount of time and then to see what it would kill it. That's a use dilution test. So that's what we do in the United States. Now other countries do different things. There is a different test that they use in the European Union. and they use a Kelsey-Sykes test, a little bit different. So just know that things that done in different countries may have different standards. They may not be the same. Some of those are more lenient standards, some of them may be stricter, it just depends. But just know different countries have their own sets of standards when they're evaluating this disinfection techniques. Now, both of those previous ones, the Kelsey-Sykes and the use dilution test that we use in the United States, both of those are done in the laboratory where we can control variables. There is another method of testing and evaluation that they use. It's called in-use test. And this is, so say I do all the lab stuff that I'm supposed to do, and I measure it out, and I says it gets rid of E. coli at this dilution, and you need to leave it for this amount of time, and this is what happens. But then how do I know that when I go out into my kitchen or into a hospital setting, does it really do that? In the laboratory, I've got one bacteria, I've got everything controlled, and we know that that's not life. So this in-use test is when you go out to the environment that you're going to use this product, whether it's my kitchen or whether it's a hospital, and you swab the environment. You remember our environmental swabs? I just take a swab, see what grows from that. So you swab the environment and let that grow, and then you treat the environment with your disinfection technique, and then you swab it immediately again. Did you get rid of what you think you got rid of? So that's your in-use test, and you compare the original before your disinfection protocol with the after you disinfect it to see what was left. This is called an in-use test, and so they use some combinations of those for that. So that's a different type of test. Again, you're looking at it done a little differently. Okay, so in-use test, swabs are taken before and after your disinfection treatments, and then compared. That, so you know it's actually working in the environment you think it's working in. Okay, so we are going to stop that video there. We will pick up with the next section. The next section we are talking about controlling microbial growth by physical methods. We're not going to use any chemicals. We're just going to say how can we alter our physical environment to reduce microbial growth. Okay, stay with me. Keep going. Thanks, guys.